Could you please give the Commission your full name, your professional address and the post that you hold?
Yes, my name is Carmel Cahill. I'm Chair of Healthwatch Ealing, and the address of Healthwatch is Lido Centre, 63 Mattock Lane, West Ealing.
And if you, in the bundle in front of you, if you turn to page 673, please. I think it's towards the back of that bundle. Is that your submission?
It is our submission.
And can you confirm it's true to the best of your knowledge and understanding, and you wish it to stand as your evidence for the Commission?
Yes.
I wanted to ask you first of all if you could please explain a bit about the role of Healthwatch Ealing.
Yeah.
Who's it made up of in terms of board and staff and so on and so forth?
Okay. Healthwatch is a voluntary organisation, as they are across the whole country. They are all independent social enterprises and or charities. Each Healthwatch, and they are all slightly different. In Ealing, we have a board of trustees to run the organisation as a voluntary organisation, and I want to be really clear about that. We then have a staff team who coordinates volunteers who undertake the work of Healthwatch.
So 3 tiers, if you like: board,
yep.
Staff, volunteers. Is that's
right? Pretty right.
And to whom does Ealing Healthwatch report?
We are funded through money from the DOH, which is passported to the local authority. We have a contract with the local authority, and we also have a reporting line to Healthwatch England and through them to the CQC.
Now, just looking at your submission, is part of your remit to cascade information about the Shaping a Healthier Future programme? And is it any part of Healthwatch's function to offer any challenge to what Shaping a Healthier Future is proposing, perhaps as a critical friend?
Yes.
And is that something that you consider that the organisation does?
Yes.
Now, I want to ask you about your role in publicising the consultation. Now, in your document, you set out events and public meetings that you were involved with. Can you help us with your view about how successful those events were in engaging and informing the public?
Now, I'm going to say that we're going back quite a long way now, and it was an organisation that undertook it that doesn't exist now. So,
can you just help us pause there and just help us with what that organisation was?
Right. Ealing Link was a predecessor of Healthwatch, and Healthwatch came into being around the end of consultation, well, a bit after the end of the consultation on Shaping a Healthier Future. So it was Ealing Link that undertook the first stage of this. We do, because we have had continuity in Ealing. We have had access to we have access to the archives, but some of this is going to rely on my memory as well.
Sure.
And because we do a lot of public-facing work, it can tend to run into one another. But the public meetings were very successful. We had attendances well over 100 people, and we always do in our public meetings, so that people had the opportunity to hear what people were saying. The early, what I would call pre-consultation meetings, which happened at Lord's Cricket Ground and a couple of other places around, we publicised, and I know, and I'd have to get checked on this, but there were quite large numbers in proportion to the people who went from Ealing, both those who right from the very beginning wanted to challenge Shaping a Healthier Future, and those who went to find out more.
Can I ask you please to have a look at volume 1, and you should find it in one of the bundles in front of you.
Yeah.
Could you just have a look please at page 77?
Yeah.
Now this is the submission from the London Borough of Ealing.
Okay.
If you go down to paragraph 5,
yeah,
what you can see there is a view that there's been insufficient public and patient engagement, and what they refer to is SAF engagement attended by in total 360 people.
Yeah.
Can you comment about that level of public engagement and how that sits with the picture you've just outlined of your more positive role?
Right. I in general agree with this. And we had said to Shaf through the Healthwatch chairs across North West London had formed the link chairs as they were then, a patient reference group. And we had challenged them all the time around the timing. This is the outcome, and the reason for that outcome is that they were moving too quickly. And if you're going to engaging patients and the public is a long time thing, you can't do it quickly. And leading up to the actual consultation, those public meetings were publicised at quite short notice. And that is why, and in our submission, I've said that the voluntary sector and Healthwatch knew this was happening. So they supported getting information because we all thought that our residents needed to know more. So the actual documentation around the actual consultation was available at a whole number of community venues separate from what the council is talking about here. So they were at Southall Community Alliance, Acton Community Forum, the Lido Centre in West Ealing, where we're based, and Grand Union Village in Northolt. And those are community hubs. And Healthwatch working with those community hubs tried to get more of the consultation out into the community. If you'd like me to talk a little bit more, there were difficulties because the documentation itself was quite impenetrable to your average Joe in the street. But having had a look at any of the other reconfiguration consultations, in fact, North West London was slightly less impenetrable, most of the others that I've looked at. To help people, Healthwatch actually ran some days at the Lido Centre where people could actually come in and complete the forms with assistance, and so did the other community venues. I don't have figures on how many actually attended those. They weren't huge, but that facility was available to the community, and we in fact set up half a dozen computers so that if people wanted to, they could assistantly complete them online. The online document was not easy, also because it took quite a long time to complete, and if you didn't save it every 10 minutes, you'd lose your whole document. So there were definitely issues around consultation. It certainly was not perfect by any manner of means.
So given the explanation you've given about how those figures sit with your figures, how confident are you that the consultation was widely enough disseminated amongst the relevant population?
I don't think it was perfect by any manner of means. I think that they tried reasonably hard to get it out.
So can you pause there? When you say they?
That's Shaping a Healthier Future. We, as the patient advisory group, had to push for some of the things that were done that they weren't planning. And I still think they could have done better.
Now, As you may know, we heard some evidence last week from one of your board members.
Yes.
And he expressed a degree of surprise about the submission.
Yes.
And that he hadn't seen the contents and perhaps they weren't what he was expecting.
Yes.
Can I ask you, therefore, who was involved in agreeing the contents of that submission? And to whom should it have gone, or whom did it go before it was sent out?
Well, it was prepared between two board meetings. The team put it together and I reviewed it and I took chair's action and signed it. I felt that it was primarily an operational document, giving the facts of what we had done as an organisation. It wasn't giving opinions that would need to be referred to the board before it was sent off. Although I did think it had then been sent to the board afterwards, and I have apologised to John for the fact that he hadn't received it before and it had been tabled at this next board meeting.
Can I just be clear on this so that I understand that in fact then this is a document which was not ratified by the board before it was sent out?
No.
Thank you. Now, one of the things that Mr. McNeill spoke about, I won't take you to his document unless you want me to, is that he had a particular interest in patient transport.
Yep.
And he was surprised to see in your document mention of involvement with the Transport Advisory Group.
Yes.
Can you help with what specific work your group has done with the Transport Advisory Group?
Yes, we have two Healthwatch members who actually sit on the North West London Transport Advisory Group.
And what have they reported to you in terms of their findings about what is going on and whether or not it's satisfactory?
Well, the Transport Advisory Group has tended to be project-led rather than generally led. And I think this is going to be, I think that from what John was saying, that he was talking around hospital to hospital patient transport on a general basis. I don't believe, and I would have to check with our two members who sit, that this is that work around that has actually been done by the Transport Advisory Group, as far as I'm aware. The work that they have been doing in recent times has been very much related to, they did work around A&E, and I'm not certain of the full details of that, I'd have to check with them. But in the last 6 months or so, it's been very much around the issues and around the move in maternity, because that is quite a complex transport issue.
Are you able to say whether or not Ealing Healthwatch has a view about whether or not enough has been done to explore the interface between Transport for London and what they are doing and the reconfiguration?
Well, Transport for London sit on the Transport Advisory Group as well. We have also worked with people, including some of our MPs who have been in touch with Transport for London, advocating to possibly move slightly some of the transportation. That hasn't and probably is unlikely to happen because of the numbers involved and the cost to move anything, particularly on bus routing. The numbers involved in some of these infrastructure changes are just too small to generate from Transport for London. So yes, there has been Transport for London interface all the way along as far as I can see, and I'm just getting reports back from my team. It's not an area I've been working on directly myself.
Are you therefore not able to comment on whether you think enough has been done or not?
Well, enough has been done in what respect?
In terms of Ealing Healthwatch's input into working towards sorting out the transport difficulties.
I think that our input has been exceptional. We have 2 people who have been working tirelessly over the last 6 months, who have been going out and with a team of people and testing the bus routes, and working with Transport for London to get spider maps, and challenging the North West London that they have enough data to be able to do this properly. So I think that we have worked tirelessly around transport.
Do you think that that tireless work has produced the results that you would want it to produce?
Not completely.
Now, one of the other matters which was the subject of some consternation was paragraph 3 of your document, where it says, although only a small number of Ealing residents are directly affected by the change, and that refers to...
that was the A&E.
A&E, yep. Yes. Could you please assist the Commission by explaining a little more about what that statement means and how you've arrived at it?
Well, Central Middlesex Hospital, A&E, had only been opened during the day for the last 3 years prior to opening, and so it wasn't giving a full A&E service at any rate. It had about 30 people a day going through, if my memory serves me correctly. It is not particularly accessible from all but the very north part of Ealing. So the numbers coming into it from Ealing are not great.
Sorry, can I ask you just to pause there, just so that we're not talking cross purposes? Are you saying that that paragraph relates solely to the closure of Central Middlesex Hospital?
No, I was going on to mention Hammersmith. Hammersmith Hospital, probably slightly more people use, and I haven't looked at and it's some time since I've looked at the figures, so I can't quote them, because people from East Acton would tend probably to use Attleborough, but as a proportion of the population of Ealing, those 2 would not be the largest A&E places where people from Ealing would go.
And what do you say then, because I had thought I perhaps misunderstood this, what do you say then is the impact, or will be the impact, if Ealing Hospital Accident and Emergency is closed? Will that impact on a small or a large population group?
The answer is I don't really know at this stage, because as with most people here, they say that there will be some form of A&E still remain. The system is saying until that is defined, it is really difficult to make an assumption. Ealing Hospital already has very little blue light. Ambulance go there because trauma, stroke, major cardiac already go to other major centres. So there has been, those things don't go to Ealing currently, and as we see services, the big services more centralised, so there may be less. So I just don't know is the answer.
So this paragraph relates to the closures which have already taken place, not to the planned closures?
No.
And if I say to you that the London Borough of Ealing submission suggests, and it's at page 72 in volume 1 if you want to look, suggests 53%, some figures for impact on Ealing residents. It says 53% in terms of A&E. Is that a figure you recognise, or something that you think is perhaps...
This is the bottom of page 2.
No, this is volume 1.
Yeah, it's page 72.
Yeah. There are 3, you can see there are 3 sets of figures given, and it's talking about impact there. Are those figures you recognise? I'm just wondering if you can help me.
They're not ones that I know. I'd have to sort of look at them, and I'm not competent in making a judgment on them.
Can we just turn and have a little think about the maternity unit now?
Yeah.
Now we know that Dr. Palmer, who's the chair of Ealing CCG, says that further work is needed on operational readiness. I beg your pardon.
Yeah.
Can you help us with what's your understanding of where things have got to? What stage are we at?
Well, I've actually visited each of the hospitals with the internal assurance to have a patient's view.
Can I ask you to pause there before we go into your answer?
Okay.
Could you explain a little bit about what's entailed in being part of the internal assurance group and what that means?
Okay. There have been various levels of assurance that have been undertaken as part of the transition of Ealing Hospital. The North West London internal assurance had two levels. One level was that the hospitals had to go to their local CCG and report on their assurance about their readiness and be questioned on that. And then a second phase of that was that a joint group visited each of the hospitals, and that included clinicians, the senior nurse for the area, and some patient representation, and and I was one of the patients that went to all of them.
And what was your role in that process?
Well, my initial role was to watch. I thought it was to watch and listen, and that if any of the people from Ealing asked me what were these hospitals like, did they offer the service, I would actually be able to answer the question. As it happened, I was able to and felt capable of actually challenging and asking several questions as part of these reviews. And the areas that I particularly concerned of was the interface with some of the other services where the borough would not naturally interface with, such as the Ealing Local Authority's Children's Safeguarding Board and the mental health services in areas where the hospital is based, where there is a different organisation running mental health services.
Can I ask you just please to explain, because I was slightly confused by it. Paragraph 3, you talk about the work that you had done leading to a remodelling of the numbers of women who would go where.
Yes.
What was it that had been got wrong that you say you were able to get changed, if I can put it that way?
Well, the very first modelling that was done around where women would go was, I think that the easiest way of saying it was done with what was most convenient for the hospitals, and they just split the women around.
By that, do you mean the hospitals?
Yes,
the remains?
Yes, and just split them evenly. Now we said, now people are not going to move that way. People are going to make choices, and there will be various. Lots of people will make choices on very different reasons, and that they had to look further into that in doing the modelling. One of the things that we challenged was the number that would go to Imperial. Not that Imperial is any better, but it has Queen Charlotte's has an international reputation, and just through reputation, more people would probably, and no one knows until it actually happens, but that a greater number of women would probably put Imperial down as their first choice, I think that as far as choice of women and where they go, the key to it is going to be the discussion that is had at general practice level with the women and the information that they are given around the options. And this has been one of the things that I've certainly been fighting for right from day one of this, was that a really good document was produced so that every woman was able to make an informed choice around the hospitals where they might give birth. So saying, it is quite well known that quite often, particularly in some areas, but that at the moment, women will they'll go in and say, "I'm pregnant, doctor," and doctor say, "Well, we'll send you here," and that is going to take some movement.
Given what, were you able to hear the evidence of the midwife?
Yes, I was.
Given what she was saying about the specific requirements of the population in the hinterland around Ealing, what can you help us with about how that is going to be, how that loss is going to be made up?
Okay.
If you can say you can't.
Well, I can, but can I just say a couple of things beforehand? At the moment, somewhere between 60 and 65% of women who give birth in Ealing do not give birth at Ealing Hospital. The systems of how those women are dealt with all across the borough has worked quite successfully. Part of this is not just, or as I am seeing it, is not just about the women who are currently giving birth at Ealing, but giving a more consistent experience to all of the women who give birth across Ealing, those who currently already give birth at other hospitals. With the women who give birth at Ealing, yes, there are a fair number that come from Southall, but as a Greenford girl, 30% of them come from Greenford as well. So it is not just Southall who give birth at Ealing, but again, they tend to be ethnic minority, and Greenford has a very high Polish population at the moment, so there is quite a lot of Polish around. If we look at the journey of a woman goes to a GP, makes a selection of which hospital she's going to go for. She would normally then probably go to the hospital for a visit and the first scan. The rest of her antenatal most likely would be somewhere close to where she lives, probably at a children's centre. And the only times that they would, unless this is a normal birth pattern, not the more complex, and then then they would have their 2 scans in the hospital and they would give birth. So that your average woman only goes to the hospital 3 times. And that would not change with the when Ealing's not operating and giving births, and in fact, the Ealing site is likely to be used for antenatal by Hillingdon, Northwick Park, and probably Imperial as well.
So antenatal, but not birth and not postnatal, is that?
Not birth, and my memory is not as good. I can't remember postnatal. I think there will be some postnatal there as well.
Can I just ask a very simple question then?
Yeah.
Is it your view that Ealing maternity units should be closed or not?
Is it my view?
Is it your view, in your role as chair of Healthwatch, do you think it should be closed or not?
Well, the decision has been made.
I wonder if I could just press you a little bit more. If you feel unable to provide a view, please do say so, but I'm just wondering if you are able to, you could do so.
Well, I think that we've reached a stage that the answer, my heart would say no, but my head would say yes. If it is to be closed,
What's your view about the impact of continuing delays on staff and users?
I think it's extremely unfortunate.
What should be done, assuming for a moment that it's going to close, and that's right, that is where we're going, what should be done in terms of the delay to ameliorate that situation as much as possible?
Well, I think the first thing is that the workforce is really important, that there was continuing dialogue and that there is some certainty with the workforce. And if that's not done, then I think that, well, because, as the midwife said, the staffing levels are predicated on the Ealing midwives being allocated across the patch. If that doesn't happen, then the staffing levels may not be at the levels that they should be. So I would have said that workforce is probably the most important issue.
Just finally, on another little subject, the out-of-hospital services. One of the things you say is that you raise a concern about the hubs not being developed. Can you expand on that and explain to us what the hubs are and what will be missing if they're not available for several years? Okay.
And this feeds into the whole. If you go back to the beginning of Shaping a Healthier Future, our understanding was that the major reconfigurations of the hospitals would not happen until good out-of-hospital services were in place and working properly. And that's the main reason why I raised that concern in the document. And if anyone has seen the time it takes to get funding in place and to build things, it is a concern. I have read the IMBC, and don't ask me, I can't remember what IMBC means, if someone else can help me, which is the document that is going to central government to fund Shaping a Healthier Future, which has the hospitals and the out-of-hospital services. In Ealing, there are two hubs that are proposed. One is a major rebuild of an existing health centre. The second one is a brand new centre up in Greenford, which is part of a major development in the area. But those take time, and my concern is that it won't dovetail as well as it should.
And if it doesn't dovetail as well as it should, can you help us with what the impact might be?
I don't know what the impact, but I don't think it would be good.
Thank you. I'm grateful. If you'd like to wait there may be some questions from the commissioners.
Yes, good afternoon. Thank you for your presentation. I've got a series of questions I want to clarify in my mind. As Healthwatch, am I right in thinking that part of your role is assessing the impact of any change upon the population?
I don't think we have the expertise to do that. I think that what we would do is we would get as much information as we could and question the impacts that have been done in any of the documentation that has been developed.
Well, I want to take this a bit further. Do you see yourselves in a position to assess the impact of proposed change upon the local population?
I don't know. It's interesting. I actually can't answer that question.
Well, there are reasons for these.
Yeah, obviously there is.
Well, I'm going to just follow it through.
Yes, certainly.
So you can see where I'm going.
Yeah.
You would be concerned for a population if the impact of a proposed change was going to be detrimental, wouldn't you?
Yes.
And you would want to flag that up, wouldn't you?
Yes.
What percentage in relation to the maternity unit at Ealing comes from Southall, where it's situated?
The figure is sort of somewhere around 35 to 40%, if my memory serves me correctly.
Well, we heard a figure today. I don't know whether you were here, but...
No.
No. Sahota this morning gave us a figure. He's the chair of the GLA.
I know Dr. Sahota.
Yes. Well, the figure he gave was over 50%. Did you know that?
Well, I didn't think it was quite as high as that, and I'd have to go back and look at the last figures that I had to actually be able to, because we have UB6, UB5. Well, in fact, there are people who give birth there who aren't even in the borough.
You see, you gave figures of 30% in relation to another area. If it's 50% or over, this is going to have, the closure of the maternity unit is going to have a severe impact, isn't it?
It's going to have an impact, yes.
A severe impact on at least half the population that already use it.
It will have an impact. Because of the options that have been made, and two of the hospitals are not that much further away from Southall than Ealing Hospital is.
Well, then I just want to pursue it a little further. Do you accept the evidence we've heard today that the hospital is in fact serving one of the poorest areas in the country?
I would accept that, yes.
Yes. And bearing that in mind, the people who live in one of the poorest areas of the country are less likely to have the facilities to travel. Do you agree?
I think that is probably true. But not all of the women from Southall are currently going to Ealing Hospital.
No, I didn't say they all were. I came up with a figure, not my figure, somebody else.
No.
50%. And the reason I'm concerned about this, because we've also heard that it has a very high incidence of the area, not linked necessarily to the maternity unit at all, of TB. Were you aware of that?
Ealing has a high prevalence of TB, yes.
And do you agree that the closure of facilities doesn't...
Eton Brent.
Oh, yes, all right. Do you agree that the closure of facilities doesn't exactly increase choice, does it?
I'm sorry, I'm not that's very... No. Really general.
Well, if I'm going to take a specific case of a person who lives, who's not very well off, who can't afford, certainly can't afford taxi fares, who may have to have recourse to an ambulance, which again may be unnecessary use, but necessary in her case, that if you close a unit, whether it's A&E or maternity, that is serving a hinterland of that kind, do you not agree that it is going to cause enormous disruption and anguish and have an adverse impact on that population?
It will have some impact. It's really difficult, but I don't think it's to the extent that you're portraying it at the moment.
Well, what extent do you think it doesn't have an effect?
Well, firstly, maternity is a pretty normal thing at any rate. I mean, as a woman who's had babies, it's not an illness. That the majority of women go through and have their babies without too much difficulty, and where they go to have them is not a major issue. I think that there is a percentage of women who need a lot more assistance, particularly those who have comorbidities and already have illnesses. where they would have to spend more time, and that they would have to attend hospitals a little further away, and that could cause difficulties for them, definitely.
One final matter, and that relates to out-of-hospital developments. To what extent are services being closed down before alternatives have been established?
There haven't been any that I'm aware of at the moment, but I raised it as a concern.
Are there any planned?
Not that I'm aware of at this particular moment in time.
Thank you.
I notice you say in your second paragraph, you say that at the end, towards the end, as active lay partners, our members have taken part in a range of strategic meetings over the last 3 years. They've devoted their time to analysing and challenging business cases. What areas have you chosen to challenge the business case that you've seen? And I noticed also you referred to an investment-making business case, the IMBC.
Yeah.
We've been told for this commission that that's not available to us because it's not complete. Well, what version have you seen, and when was it?
I think the last version I saw was draft version 4 or 5. I have to go and look and see what the number was. There is a group of lay partners who have been asked to review it from a lay person's perspective to see what they felt was said in the IMBC resonated with them or not.
But all the numbers have changed from the beginning, from the first business
Certainly
case.
Has.
Yes. So you're not sure whether you've seen the final one or not?
I don't think there is a final one yet.
But they are closing things already, so it would seem to be that they ought to have a final business case before they proceed. Would you say that's right or not?
Well, the business case is around investment to build new estate.
Yes, but it's also about closing things to send people to those new facilities, isn't it?
Well, if you're talking about closing the maternity, the initial request to look at transition of maternity actually came from the hospital itself.
Well, I wasn't particularly looking at that. I was thinking we've already seen 2 of the 4 A&Es that they wanted to close as part of this same business transformation, as it were, have already closed. And although they might not serve huge numbers of people directly in Ealing, certainly the people who are no longer going there are going to be sharing facilities with people from Ealing, which would mean quite a large number of Ealing people would be affected. But I'm also saying, look, the business case is about the entire process. It's not simply about where to invest, is it? It's about what services would remain where.
Well, it is about it states the services that are going to be around, yeah.
Yeah. And so if they're going to close something, it would be in there. And if they're going to spend money, it would be in there.
Certain expenditure. But there, it's such a big document.
Yes. Would you expect a strategy such as that to be in place before they started doing it? Is it the sort of thing you just start and hope it's going to work out in the end?
It would be preferable.
Yeah. So what areas have you challenged in the business case?
Well, the main area that we challenged was around the out-of-hospital developments, which we didn't feel were given enough prominence in the actual development of the business case when we saw it.
But that's quite a substantial element of the business
Quite
case,
a
isn't it?
substantial
So you're going to
element.
close hospitals and you're not going to replace them with clearly defined alternative services.
They were in there, but we felt that the IMBC had a far too acute bias, and that the out-of-hospitals needed to have a stronger bias within the document.
Okay, and you just in your final paragraph, you say Healthwatch Ealing is committed to ensuring the plans around the out-of-hospital developments are fully implemented prior to the closing of any services currently delivered in acute settings.
Yeah.
Would that include maternity or not?
Well, the answer on that is that that the decision on closing maternity was made. It was a matter of when, and the hospital had come and asked to look at a transition program. So because of that, I would say that we would support it.
So your view that you act to challenge the proposals stops when they've decided. You didn't start to just help them implement.
No, I didn't say that. What I said was that we'd looked at it. They'd been asked. The CCG had been asked to look at transition because of the falling numbers, which the numbers had fallen ahead of this. Because in fact, the numbers I think are down around 2.2 for this currently. For this year at Ealing Hospital at births, and we've been working alongside and saying if we're going to do this, we've got to do it properly.
Okay, this is my final point, but I mean this process has been going since 2011, yeah. The whole process.
The whole process.
Right. So by last year, we were 3 years into it. So would it surprise you that people are not necessarily confident to have their births in place, so they're not sure if it's going to be open or not?
No.
I'm afraid I want to push a little bit along those lines. I sense somebody who's... sorry, yes. I sense a volunteer who's working very, very hard, as they see it, on behalf of people of Ealing.
Yeah.
I must admit, as an Ealing resident, I wasn't as aware as I should be before this project on the work of Ealing Healthwatch. Again, having said that, the watch bit in the Healthwatch makes me assume that yes, you would indeed be a critical friend. So I'm quite interested, having read what you've read, and knowing that there's so much going on there is to challenge about this project. I'm trying to form a view of the role of Healthwatches and what the pressures are on you. And for example, I suppose if, say, early on, a couple of years ago, you and your colleagues on the board, for example, had formed a view that this was just terrible, that the most deprived areas were losing out, and where the most privileged areas in North West Thames were gaining. I'm sorry, but that's a gut reaction that one has about this. If you'd formed that view against it, what would have been your position, your board member's position, in respect of the authorities in Healthwatch?
It's difficult to sort of
Would you have all resigned en masse, for example?
Well, I wouldn't have thought so. We would have said if we'd felt that, and we certainly would have put information out. Because I see. Because we are very small organisations.
Yes.
There is only so much as an organisation that we can do. So if we try, our key thing is to look at what information is available, get as much as it can, so that people can make up their own mind, and and either join in a challenge, or if they have a particular point of view, form a group around that would take that forward. Because as such small organisations, with such a broad remit, there is only so much that we can do.
So you're more of an information service rather than an advisory service?
Well, information... why do you make the differentiation between the two? Because I'm not sure.
For example, you might. It might have been, if you'd formed a view, say, a couple of years ago, or even more recently, say you formed a view as a result of this Commission's work, that something very bad was going to happen for the residents of Ealing. I'm only saying, because, I mean, it might come from a gut reaction that poor people are losing out. People again. But
well, we have.
Would you?
Yes.
Who?
Okay.
Who would you confront, for example, about?
Okay. There are various levers that we have.
Yes, thank you. Yes.
There are various levers we have. One is escalating it to Healthwatch England to say, look, this is happening and it's not good. What support can you give us? The second one is that we do have a right to contact the CQC if we think that that things are not right in any of the services. And we always give information prior to any CQC visit. So we have those sort of levers. As chair, I also sit on the Health and Wellbeing Board, whether it be about this or about other things, I have certainly said on the Health and Wellbeing Board quite vociferously about some things that I have not agreed with. So we do have mechanisms to be able to raise a voice.
I mean, do you think you're listened to by the people with power, for example? Politicians, for example?
Variable.
Variable. Well, thank you very much. Thank you.
Yes, thank you very much indeed for attending.
That's great.
Thank you.